antigen negative, core antibody negative, surface antibody negative. Everything is negative. It's actually good thing that they don't have antigen. That's perfect. They don't have virus inside. But on the other side, they don't even have surface antibody. What is surface antibody? When we have surface, okay, it's good. That is protective layer. This patient don't even have protective layer. Well, how do we get protective layer? We get protective layer from the vaccine. So that tells us that this patient never had vaccine because their protective layer is negative. So surface antibody negative, core antibody negative, antigen negative. Everything's negative. This patient is susceptible for infection. If that person comes across to that infected person, he's gonna get hepatitis. So how do we protect this patient? We give this patient vaccine, make him immune. How do we make him immune? Give them vaccine. So once we give patient vaccine, what do we see? Then they're gonna have this protective layer that is surface antibody positive. That means immune because of the vaccine. When we give them vaccine, they're gonna have antigen negative, core antibody negative, surface antibody positive. Super good. Okay. Now, another person who came in contact with infected person. Now we are ordering antigen that is positive. We know that virus went inside. Okay. Their IgM, it's positive. That means they have acute infection. IgM positive, antigen positive, acute infection. Okay. Fourth scenario, antigen positive, bad. Core antibody rotten to the core, positive. That means that's chronic infection. Here, as you can see, IgM is negative. Okay. Core antibody positive, that is chronic infection. Now, let's talk about hepatitis C. So hepatitis C, how do we know that this patient is infected? Okay. So 85% of the cases are carrier for the infection. How to diagnose patient? So we ordered, it's called hepatitis C virus antibody test. Okay. If antibody is negative, antibody, those are fighter cells. Okay. Fighter cells are not present. That means they don't have hepatitis C. Next scenario is patient's fighter cell, that is hepatitis C virus antibody negative. That's good. Antibody, those are fighter cells not present. Good. But they are previously exposed to the person who had hepatitis C. So they are exposed. Their antibody, they don't have any fighter cells, those are positive, but they are exposed. What do you do? If they are exposed, then you order HCV RNA. So what is RNA? RNA is not from the patient. It's not patient's RNA, okay? Here we are talking about virus RNA. Antibody is from the patient. Virus, they also have RNA, right? So that's what we get from patient's blood, basically. So if patient have RNA from the virus is positive, that means they are infected because virus is actually inside, okay? Antibody is there to fight against virus, and virus is there. That means RNA is there from the virus. Both there, that means patient has hepatitis C. If antibody is there and no virus, that means no hepatitis C. Okay. So I hope that helps. Virus there and antibody there, that means hepatitis C. Antibody is there but no virus, that is RNA negative, that means no hepatitis C. Now let's talk about C. diff. So what is the definition for C. diff? They have this diarrhea going on 10 to 15 times. Watery diarrhea. What is the cause for this diarrhea? They're having this watery diarrhea constant. What is the cause? So our body, they already have C. diff, okay? C. diff is the part of our body. But C. diff doesn't exaggerate, or those bacteria just stays inside. It doesn't cause any trouble, okay? But when person for some reason had to take multiple different antibiotics, the job of antibiotic is to kill. It kills the good bacteria, it kills the bad bacteria. When it starts killing, it kills the good one as well. When it kills the good bacteria in the gut, the C. diff, it takes over, okay? C. diff is becoming in charge. And that's where it replicates. So it's just like, gets tons of them in there. And that's why patient has constant diarrhea. Some medication that can cause patient to have C. diff, that is clindamycin, penicillin, cephalosporin, fluoroquinolone. If patient is taking this medication for long period of time, they can have C. diff, okay? So what is the choice of treatment? Choice of treatment is basically they have to drink vancomycin, that is liquid. IV vancomycin is not the choice of treatment for C. diff. They have to drink vancomycin, that is liquid vancomycin. And vancomycin does not come in the pill form either. Okay, it's liquid. So number one choice is oral liquid vancomycin. Or you can also use Flagyl, that is metronidazole, for 10 to 15 days. Next one is Crohn's disease and ulcerative colitis. So what is Crohn's disease? It's inflammation of the segment in the GI tract, any segment. It's from the mouth to